introduce Jamie Wylam, who is Dr. Jamie Wylam, who's joined us to answer some of the questions that have been submitted, but also questions from yourselves from the floor. And of course, we have our Director of Public Health, Greg Fell, with us. And Dan Spicer, of course. So they're the council officers that are going to guide us through ensuring that we get the questions that you've raised answered. Jackie, would you like to introduce yourself?
Yes, hi everybody, afternoon. My name's Councillor Jackie Drayton. I'm the Councillor for Burngreave Ward, and I'm also the Cabinet Member for Children, Young People and Families with responsibility for public health as well. Thank you.
Thank you. Shafak?
My name's Sheffield. I'm a councillor for the Ecclesall ward in the city and also the leader of the opposition on the council.
Thank you. Douglas?
Thank you, Julie. I'm Douglas Johnson. I'm a councillor for City Ward and I'm one of the Green Party councillors on the council.
Thank you. So the process for today is Greg will be covering a presentation and then after that, we take the questions that have already been submitted. So we'll invite you into the room to ask your question. And then we open it up to anyone else that wishes to raise any questions they've thought of since, but also particularly from the presentation. So first and foremost, over to you, Greg, for the presentation, where we are at in Sheffield.
Thanks, Chair. So I should be reasonably quick on this, about 10 or 15 slides, and Dan has them, and we'll put them on the website later so people can take them away and keep them. So I shall share my screen. Oh, there. Someone tell me they can see that.
Yep.
Yep. Fine. I'll just put it on slideshow. So situation report as of today. It will be out of date by tomorrow, as is always the case. Talk a little bit about the epidemiology, a little bit about a bit of crystal ball gazing on the future, and a little bit about the strategy. And to cut to the chase, the strategy remains the strategy, and the plan remains the plan. The fundamentals haven't changed despite all the changes around us. So, firstly, the epidemiology in a single chart. Epidemiology is the case is high, but as you can see, falling quite rapidly at the moment. You can see the chart for yourself. That's a number of cases diagnosed per day, every day since February. So you can see the look and the feel of the second wave. You can see the epidemiology curve for yourself. About 186 cases a day. And the 7-day incidence, which is one of the key metrics, is 200. It's just less than 200 cases over the last 7 days in per 100,000 people, and 11. The positivity, which is one of the other key metrics, is 11%. It's worth me saying that just last week, about a week ago, cases were per day, or 7-day instance was in the order of 300 per 100,000, and positivity was about 15 or nearly 16% literally a week ago. So you can see these numbers are changing quite quickly and obviously going in the right direction at still quite a high level though, and that's obviously one concern, and I shall come back onto that later. The two graphs on this chart, is the transmission is still principally household. So all of the transmission events, the passage of the virus from one person to another, most of those are happening in households for a number of reasons. One, we spend most time there. Two, they are the least COVID secure. We don't wash down high touch points every 30 minutes with antibacterial soap, for instance. We tend not to wash our hands a great deal in our house. We feel safe, and we let our guard down. And as a result, most of the transmission events are still in households, and most of the risk is households to household transmission. Household mixing is still the principal risk. The two charts are, this was about a week and a half ago. This is as of yesterday, and we've seen the pattern of the transmission of the virus shrinking into the east of the city for a number of reasons. One, because there are more people with occupations that actually require them to work face to face with other people can't be done online, can't be done from spare bedrooms, for instance, like mine can. Secondly, more crowded housing, and more people living in more housing and more densely packed communities. So for those reasons, that the transmission is principally becoming an issue of the east of the city, and we've seen that before. And that is a sad reality. So that is a concern. And accordingly, we're putting a lot of our energy into the east of the city and not so much into the west. Age-specific rates are now. This is a slide that's about a week and a half old now. They're now falling across the board, not rising across the board. A couple of weeks ago, the rate of rise was reasonably quick but slowing, and now I think for all age groups, rate of the 7-day rate of transmission in each of the age groups is decreasing, and the average age of a case is stable to beginning to fall over the last week or so. The oddity which I've talked about before is this group, which is the 18 to 24-year-olds. This is the student population. There was a big spike in cases as the universities restarted, and that's happened in, as far as I'm aware, almost every northern university town. The same pattern has been seen. If you take the 18 to 24-year-old population out, we're just like the rest of South Yorkshire, actually, slightly lower than the rest of South Yorkshire, but just like the rest of South Yorkshire. The incidence in the elderly is going down. So what the analyst, one of my analysts that produced this chart, was very excited when he saw there was some green. He could finally put green on the chart over the last week or so. One of the key indicators, one of the key thresholds, is the 7-day rate per 100,000 in the over 65s, and getting that rate to less than 150 per 100,000. We've achieved that, and again, you can see the shape of the shape and nature and direction of the curve for yourself, and that's fairly straightforward. This is the group that we're most worried about, because this is the group that are more likely to be severely affected. Younger populations will be severely affected, but in terms of the sheer numbers, most of the hospitalizations will be in the over 65. So that the incidence rate is going down is very, very, very welcome news indeed. And I would expect that to continue to go down. I see no reason why that would change in the immediate future. Hospitals are the key pinch point. This is Sheffield Teaching Hospital data. Hospital activity is falling slowly, and I think it will continue to fall slowly. And it's fair to say the interpretation of that data is quite nuanced. So blue is COVID patients receiving oxygen. Red is COVID patients on non-invasive ventilation, and orangey is COVID patients receiving mechanical ventilation. And you can see that the overall trend is now slightly downwards. I think that will fall very slowly, and that's to do with a time lag between becoming infected, becoming very poorly, and becoming poorly enough to require hospitalization, and then becoming poorly enough to require shifting from a general bed to an intensive care bed. That's quite a long time lag. So, and I would expect the level of hospital activity to fall, but it is falling, but I'd expect it to fall quite slowly, sadly. And now, and again, the other point of nuance is that it's falling, and that is undoubtedly excellent news, particularly for those people who are directly affected, but it's falling from a very high rate. Hospitals are very, very, very busy. Hence, one of the things that we're trying to avoid is hospitals being overwhelmed. Ours wasn't, and won't be. But we've got very little room for manoeuvre. And it's a busy time of year for hospitals up and down the country. So the news is good, but and it's the but bit that worries us all. Deaths. This is deaths according deaths where COVID is mentioned on the death certificate, both hospital and community, a number per day. You can see wave 1 and wave 2 for yourself. It's reasonably plain to see. Ignore the tiny little, or the big tail off at the end. That's to do with just not having complete data yet. My sense is there's been a significant increase, no doubts about that. It's beginning to plateau, but again, like hospitalisation, it lags a bit further behind. So I think that will fall slowly for some time to come. So epidemiology summary, we're now seeing less than 200 cases per 100,000 population in a 7-day period. That's good news. That's continuing to fall. That metric is the 3rd lowest in Yorkshire. Up until the other day, it was the 2nd lowest in Yorkshire, but North Yorkshire has fallen a bit faster than us, so we've been overtaken in that particular chart. But the 3rd lowest in Yorkshire, given our population, is some achievement. So thank you to Sheffielders who have done the right thing there, undoubtedly. Positivity, i.e. the proportion of people who have symptoms and get a test and test positive, a week and a half ago was 15%, now it's 11%, and that's continuing to fall. A significant proportion of Sheffield teaching hospitals bed have a patient with COVID in it. It's flat to falling, and that's good. But at this level, it's still difficult to manage. That gives us very little wriggle room and very little room for manoeuvre. So I think as a city, we still need to be careful. Thus, my last point, my messaging is that we mustn't do anything to make it worse because the numbers are too high for comfort. We're 2-3 weeks into the lockdown now. The tiered system and the lockdown have helped, undoubtedly. You look at the shape of the epidemic curve and of the first slide I showed, that's on account of the measures that were put into place. And I shall now do a brief note on where next. This is, I think it's Google data. If you own a phone with Google on it, Google monitors where you go. I own a phone with Google on it, so it monitors where I go. And it's the mobility data, which is just a measure of are we moving around less or more, which is one indicator of the likelihood of coming across other people, which is an indicator of the likelihood of becoming infected, and thus the chain goes. The baseline is the black line in the middle. You can see what happened in the lockdown period way back in March. Movement went right down, has gone up, but since we started applying measures up and down the country, and this is Sheffield data, from October onwards, movement has gone down. Our aim was to get level of mobility down to May level, to get it right down to May level. We'll likely get to June level by the 2nd of December. The national lockdown and the measures before that have undoubtedly achieved what they set out to do, albeit at some cost. And the cost is the bit that worries us all. The purpose of the lockdown was to get R0, the level of infectivity of the virus, to below 1. So if it equals 1, every one person that is infected will only infect one other. If it's 2, every person that's infected will infect two other people. So it was running at about 1.6. My dogs are going mad, sorry. It was running at a level of about 1.6 in the not too distant past. Hence, rates were going up. It's now hovering at just above 1, and the purpose was to get to 1 and to get the level of infection back to mid-May levels, which was quite ambitious. R0 is driven by out-of-household contacts, household-to-household contact, and lockdown will and has undoubtedly made a difference to that and reduced the mean number of contacts per case. Arguably, reset expectations and behaviour. However, there are caveats, and the huge caveat is people will be fed up. I'm certainly fed up, and I expect lots of other people are fed up. So when we get fed up and when we stop following the rules, that's when we get into worrisome territory. That does need some continual thought. It doesn't change the fundamentals. The fundamentals, limiting the amount of mixing, hand washing, distance, face coverings, etc., have been the fundamentals from the start and will remain the fundamentals till the end. the danger, as restrictions are taken off in 2nd of December, positive changes may be lost. Probably not the case, because we're in tier 3. That is a government decision, it's not our decision, but we are where we are. So I think we will continue to see rates continuing to go down, which it can only be a good thing, because it remains a dangerous respiratory virus that still kills people and hospitalizes people. I think we'll be lucky to get R0 to 0.9, substantially below 1, certainly. Remember, March got us to 0.6. I don't think we'll get to 0.6, nowhere near. So I think we'll get to a position where R0 is just below 1, and the numbers are, the rate of infection is still quite high, admittedly going in the right direction, but still quite high. So the takeoff potential is there, very significant, and the room for manoeuvre is limited. The dorky epidemiology, and apologies, but this time versus last time. So pre-March, pre the first lockdown, R0 was 3, and the epidemic was doubling every 3 or 4 days. The data is crystal clear. That was national and it was local. March lockdown abruptly reduced contact rates, and R0 fell to about 0.6. And we were dealing with levels of infection in the summer of in the order of 15 to 20 per 100,000. Now we've got R0 is 1.1, maybe 1.2, doubling times into in the 2 to 3 week range, maybe longer, and that reflects moments. I think get R0 to 1, as I said, but infection gives little room for manoeuvre. Thus, we've got limited room, relaxing. There's a lot of reminding people regularly and do the same. The last thing we want to do is take the run up to the most difficult time of the year for NHS and social care, early new. I think we just need to be careful. Sadly, what will the next 6 months look like? Very was the one to read these paper referenced at the bottom. Very good. It's scenarios for the next 6 months. Bit of crystal ball gazing. They're all.
Are you? We're having. Sorry, Greg. We're having a bit of difficulty.
Video will help.
Greg, sorry, we're having a bit of difficulty hearing you. You keep cutting out. Do you want to just try again, and then we'll see if it's your connection?
Am I any better?
Yeah, I can hear you now. Yeah, thank you.
So I'll just go back to where I think I got to. So Sage did some crystal ball gazing. It's very worth reading, actually. If you want, I tried to summarize it on a YouTube video, which is there. 4 scenarios: high and uncontrolled, which is not where we are now. High and controlled, which is, I think, where we are now, but where we all want to get to is low and controlled. And the Sage's recommendations to get low and controlled are there. And to cut to the chase, the fundamentals will remain the fundamentals. Tier 1 is probably not enough to get us to low and controlled. Tier 2 might be, Tier 3 is, but clearly we don't want to be in Tier 3 for a long time, because Tier 3 comes with substantial social and economic costs. So it is worth reading some of that stuff, and it is certainly informing government strategy. All routes forward are bad. I don't know what the exit strategy is. The government haven't published the exit strategy. We have done some work locally in South Yorkshire on what an exit strategy might look like, and we are probably in the space of Tier 2 to Tier 3 territory, but it isn't our call. I'm guessing there, and it's definitely not our call. It's a government call. The vaccination is coming, which is stupendously good news. But it will take 4 months for us to get fully vaccinated. I'm not anticipating that there'll be substantial quantities of vaccine available this calendar year. I sincerely hope I am wrong, but I think when there is substantial quantities of vaccine, we will be all hands to the pump. Treatments have improved a lot. I hear a lot of people saying, I don't want to go in hospital because I'll never come out, which is an unfortunate thing to say, because treatments that the hospitals use for people with very severe illness have improved amazingly. over the last couple of months, and credit to the clinicians and hospital service managers who've done the research to work that out. Sadly for me and you, we remain reliant on basic public health interventions for the foreseeable future. Lockdown buys us time, but the basics remain the basics, so we're continuing to improve contact tracing and isolation. We are doing all we can to adapt physical and social environments, ventilation, spacing, remote working. The easy stuff has been done, however. We've definitely done the easy stuff, and we're continuing to be clear and consistent about our messaging. Trust and confidence in the message and the messenger is key. And through all of the thousands of pages of complex and often conflicting guidance, we're trying to boil it back to the core principles. And last thing that does concern all of us greatly is the mental health impact of the consequences of the interventions that we take. The complex slide, and I won't dwell on it, but broad strategy and the plan remains in place. So the strategy is really simple: keep people safe, protect the vulnerable, reopen Sheffield. We have a plan, which is the outbreak control plan. It's owned by the Coronavirus Prevention and Management Board, and we've got a range of operational details set up to ensure that that plan gets implemented, which are set out on the diagram, and I'm not going to dwell over every part of the diagram. People can do that at their leisure. We have a matrix of interventions. There is no single silver bullet, but we will implement the right interventions based on evidence base over a long period in time, and that will be the case for quite a while to come. The evidence says these are the things that make a difference. Accordingly, that's where we have structured our plan around prevention, managing individual outbreaks across lots of different types of settings, maximising testing or minimising testing delay, getting tested even if your symptoms are mild, contact tracing, speed and coverage matter, optimising isolation, and clear, simple comms, focused on consent and consensus rather than harder-edged enforcement. So we have a plan of those of you that want to read it. The links are at the bottom of the page, so you can read those at your leisure. But we have names in frame to lead each of the themes of the plan, and we have an infrastructure to deliver it. We keep adding to the plan. The things of the moment are testing those who don't have symptoms, or alternatively known as mass testing, which I think we'll come on to in a second, and vaccination, which is coming over the very near horizon, thankfully. Next week or two, I think, post 2nd of December needs some considerable thought. Then what happens in the next review period, mid-December? Testing. We have mass testing in place. It's significant quantity of testing for those who've got symptoms, and that's by far the most important thing to break chains of transmission. We will be getting into testing those who don't have symptoms. Some call that mass testing. There's the obvious, the Liverpool pilots, and we've not seen the results of the Liverpool pilot yet. And the purpose of pilots is to run pilots. So that may or may not become a thing, but we will be using lateral flow testing where we know we can have maximum benefit within a number of defined cohorts. Preparing for vaccination, then localizing contact tracing. We've now stood up, we're a month and a half into a local contact tracing service, and our completion rates with the proportion of people who are contacted and given advice is 75, close to 80%, which is much better than NHS test and trace. I shall stop there and stop sharing. Thank you, Julie.
Right, lovely. Thank you very much, Greg. At this point, Jamie, I'm sorry. Oh, I've got something popped up, so it's out of my way. Could you possibly just run through, Jamie, what it means to be in Tier 3 from next week, which is different to Tier 3 last time? So what are the things that are generally will still remain open, and what are the things that will close? And then we'll go into questions, because there's some specific questions about will a bingo hall open. But if you could just explain in general what will close and what will remain open and what we can and can't do, that might be helpful for the audience.
Yeah, of course I can. So just to start around socialising, meeting with friends, that's very similar to last time. when we were in tier 3. So you mustn't meet anyone socially indoors who isn't part of your household or your support bubble. And you also mustn't do that in a private garden or most outside spaces. But what's slightly different this time is that you can meet in groups of no more than 6. So the rule of 6 has been brought back in some outdoor public spaces. So that would include things like parks, countryside, a public garden, that sort of venue. You can continue to visit places within your household and your support bubble if you have one. And we are now seeing the reopening of retail. So where previously non-essential retail has been closed this month, things like shops and places you might buy gifts for Christmas will be reopening, and you can visit those either alone or with your household or your support bubble. We're also seeing the return of sort of close contact beauty and hair services, so things like hairdressers, beauty salons, tattoo parlours. Nail spas will be open again. And again, as with all of these things, you must only visit them with your household or support bubble when they are open. What we're not seeing open is hospitality settings, things like bars, pubs, cafes, restaurants will remain open other than for takeaway or click and collect or sort of drive through. So they will remain closed, as will other hospitality settings, such as entertainment venues, so things like your indoor play centres, casinos, bingo halls, bowling alleys, ice skating rinks, amusement arcades, snooker halls, and some outdoor attractions will have indoor attractions as part of them, and they'll remain closed. So things like aquariums, for example, or museums, or botanical garden glass houses, which we obviously have in Sheffield. Along with that, within hospitality, we're not having the opening of performance venues, and because we're in tier 3, we also won't have spectators at sport in outdoor events, and hotels will remain closed. So they're the main sort of changes is within the hospitality realm. We're seeing the opening of gyms again, but not exercise classes within those. Only outdoor classes can happen, and that's a sort of main summary of the things which have changed, sort of in general.
Yeah, good. Thank you very much, Jamie. I do think that was really helpful. As I say, there are some specifics, but I think generally they'll have got the idea about, probably already got the answers to them, but we will bring them in to ask the questions. I have someone that has said that they would like to ask a question, but they are due to go elsewhere at 3 o'clock. And I'm looking for the person who are expecting a child, I believe.
Pravi Srinivasan.
Yeah,
Yeah,
that's it. I'm scrolling down. Praveen, is Praveen here? She's said that she's got to go. No, Praveen. He's got to go somewhere, I think. Yeah? Is he there? Hello? I can't hear. If you're having trouble, I can read out the question, but if you would like to try again.
It sounds like panelists can't hear for some reason.
None of them.
Everyone else can.
Oh, everyone can hear, but us few.
Yeah, I'm not able to hear either.
No, I don't think anybody can hear now, Julie.
Oh, that might be a problem. If would that apply to all the other people, Dan, do you think?
We can't hear you, Dan. We can't hear you, Dan. You're muted.
Sorry,
Dan,
I don't know, Julie, I'm afraid. We'll have to see.
While you're trying to sort that out, I will read Praveen's question out. And then if it appears that we have a technical problem, then I'll go through the questions. Praveen, I have been advised that as a partner of a 34-week pregnant wife, I will only be allowed to be with her in the hospital just after she is in labour. These are very difficult times, and we have our families abroad who cannot join us to celebrate the birth or be with us. My question to the government is, will these restrictions ease out a bit with tier 3 restrictions in Sheffield so that I can mentally and physically be there next to my wife for support through her time at the hospital and even after the baby is born? I get the point if pubs are open, but they're not in Sheffield. All I'm asking is for me to be there with my wife throughout her time in hospital. Currently, I understand that there are no visiting hours either for partners, which is extreme and unethical. Well, firstly, congratulations on the forthcoming birth of your child. As we've said on many occasions, we're all very sorry that the current situation is making it difficult for everyone, but especially for someone in your circumstances to enjoy and celebrate this wonderful, wonderful occasion that you would like to. We would suggest discussing what is and isn't possible with your midwife or with the Jessop's wing. The website currently states that one birth partner is allowed in labour and that visiting will be allowed for 1 hour a day. But please keep checking, as it may change before the birth. So what we'll do, Praveen, is we'll send you a written response if we have your email address, and hopefully you can get regular updates, because things do change over time. And we wish you all the best. As you say, 34 weeks pregnant, you've probably hopefully got another 6 weeks or so to go. So hopefully during this period, things will change in a very positive way for yourselves to, as I say, celebrate and enjoy the joyous occasion that you are looking forward to. And we'll respond in writing, as I say. But do speak to your midwife, and certainly with the Jessop's wing, and I'm sure they will be most helpful. Right, Dan, are we, sorry, Jamie.
Just saying thank you very much. You put it brilliantly, this, you know, excellent.
So, Praveen, I'm sorry that we couldn't bring you in, but hopefully we've given you some advice, and then, as I say, contact the relevant people, check the websites, but also get back in touch. We have a helpline 2734567, and get back in touch with us at any time if you want to raise any further questions or issues. But all the best. Right, I have Diane Hancock, if Diane would like to join us.
Hello.
Oh, we can hear. Welcome, Diane.
Can you hear me? Right.
Yes.
I can't see you. Hi. Hello.
Hi.
Yes. My question is that I am a yoga teacher, and I also teach Feldenkrais, which is a body awareness movement system. I work with people who struggle with their movement, but also they are, particularly in lockdown, suffering quite badly with mental health kind of issues. So my question is, as far as I can understand it, I could do one-to-one work, but for my classes, I teach in a very large hall where we've got a one-way entry and exit system. We have hand sanitizers. We can put the mats down to 2 to 3 meters distance, and there's no aerobic activity. People are doing very, very quiet, gentle work lying on a mat, and I'm just guiding them, so they're not, I don't go anywhere near them, they just listen to my voice. And And I just need to know, in all the guidelines, I can't see whether I can run my classes or not. And I really, people are depending on kind of having this contact, not just with me, but also the experience of being in a room with people and being able to do some meditation and some mindfulness, which is a large part of my practice. So can I do this?
Yeah, can I say thank you for raising this question, because when I first looked at the rules, it was confusing for me. So I'm hoping Jamie or Greg's got the answer to this, because it said in all tiers, certain things remain open, like non-essential retail. And it did say dance and fitness centres will all remain open. But then in tier 3, you can't actually carry out any dance and fitness activity in a group. So it is confusing. Jamie, I don't know if you've got the answer to this.
Yeah, so while in tier 3, you're right, no group activity can happen. So things like a group yoga class, or a group dance class or group fitness class of any kind can't take place indoors. So the place they could take place is outdoors. So you might have seen, for example, fitness groups in the park, doing things together in a group. So in tier 3, nothing of that sort can happen indoors. So the yoga class, as you say, one-on-one can, but not in a group. We ask that people try to do alternative things, like, for example, Zoom home classes, which have been going on, or do things outdoors where it's possible, or, as you say, work on a one-to-one basis. I appreciate, Diana, it is really frustrating, isn't it, when the sort of type of exercise you're doing, it doesn't feel as aerobic as some other exercises, but in tier 3, the rules are that none can take place regardless of the type of indoor exercise in a group.
Thank you, Jamie. I think that is the problem, is that if people can go to the gym where you actually are expelling air indoors, much more forcefully than in a yoga class. And say I do Feldenkrais work, which is even quieter, but it is because of the mindfulness aspect of it. It's not just the physical, but it's been able to help people through this work. And I've actually got a lot of the people that usually come to my classes are not comfortable with Zoom. For some, they find it very stressful dealing with the technology, and you've had technical issues yourselves today, so that adds to your stress if you're struggling with be able to hear something or see something. And for some people, they don't have the technology for different reasons. I mean, for some people, it is a generational thing. I'm not saying, I'm of an age where I'm not going to say that older people kind of can't handle the technology. It happens to younger people too. So, it can't all happen in Zoom. And unfortunately, with very quiet, gentle, non-aerobic activity, doing it outdoors is when you lie down, I think is just not in Sheffield in December. That's going to be
that point, Dan, is part of the sort of SAGE documents which are publicly available about the sort of decisions that were made around lockdowns. That sort of cold outdoors was one of the things that came into their decision around opening gyms. So to lots of us, it feels counterintuitive that a gym would be open because people heavy breathe, but part of that discussion was around the health and well-being benefits for people who might not have a garden or outdoor space, for example. So it is all a balance of risks. I suppose at the moment we're saying to people you can't meet in a group anywhere indoors to do anything, so you can't even sit in a restaurant together in tier 3. So even though I acknowledge that yoga isn't a huge aerobic activity, you couldn't sit and do anything with anyone in a group in tier 3, and I think that's more the kind of basic principle, is just a group can't be together indoors.
But can I work if I have a mask and a visor on? I can still do one-to-one work.
I must admit, Dan, I'd have to check
Was
the
it just one other
specifics.
person?
I think so, but I would have to double check for you. I can definitely look into that and make sure it gets back to you.
Yeah, I think we should get back. As I said, I was quite confused about that, because it was sort of if all dance centres remain open in all tiers, but in tier 3 you can't, you know, in my dance classes in the past, long and distant past, that I'm looking forward to doing more of next year, we danced in groups. You know, it was a group session. I don't just hire a room and go and dance on my own. Sort of, so it is one of those confusing. So thank you for your question, Diane, and we will get back to you with more a detailed response on the one regarding one-to-one. So thank you very.
Can I just add to that, Julie?
I was just going to bring you in, Douglas.
Oh, thank you. Well, I was just going to say, Diane here, when I was just thinking, just reflecting on what Greg Fell was saying earlier on about the importance of mental health. And I think your question is too difficult for us to answer just like this, Diane, and I'm sure that Jamie will be able to help later on with something more specific to the individual case there. But it seems there is a distinction between group exercise that counts as leisure and that which counts as care and rehabilitation and, you know, effectively, you know, a form of medical treatment. And just having a look at the rules the last time we had tier 3, and the specific exemption about either provision of voluntary or charitable services, but also to provide care or assistance to a vulnerable person. So it might be something where, you know, you are actually able to do that. But obviously there would, you know, there'd be all the usual things about, you know, very careful risk management and social distancing within that. So I can't give you an answer, but maybe Jamie will. But yeah, I think it's a really important aspect to think about the people who really need that rehabilitation and care. Otherwise, they will, you know, fall apart in the long term.
Yeah, and there are a few specific examples, Douglas, in terms of groups with learning disabled sport. Where it's for education purposes. So if your education course revolves around sport, but yeah, we'll come back to you with a specific on the one-to-one for sure.
Yes, please, because as I say, looking at all the questions, I found this the most difficult one to answer, because normally you can navigate yourself around the websites and find it, but this was one that immediately jumped out to me, because last time I remember the discussions with government about going into tier 3, we specifically requested that part of those sort of facilities that could remain open were yoga classes, Pilates classes, gym, you know, health and well-being and other types of things, and they did. But on this occasion, it is confusing. So thank you for the question, Diane, and we will get a more specific answer, because you won't be the first asking this. I do know that last time I got several emails around this subject. So we will get a definitive response. And also, if we can find some advice on advising people, if it's not possible to do what they need to do, what can they do? As a replacement or an alternative. I think we do need to work with you and the providers of these services and this provision to help people out there who are dependent upon it, as you say. So thank you very much, Diane, and as Jamie said, we will get back to you directly.
Thank you very much. Thank you.
Thank you. Brendan Lawrence.
Hello there.
Hello, Brendan.
Hi. So yeah, a question really linked to a similar question I asked back in I think September at the last public call, and it's around safety of sending children to school at the moment. Not just from the point of view of the individuals themselves, but also their families, and the possibility they may bring something back which they could transmit to more vulnerable family members. I got the impression from a couple of months ago that it wasn't so much that there was evidence that it was safe to send children to school. It was more a case that there was no evidence that it wasn't safe, if you see what I mean. And I think I really wanted to just explore the current thinking on that, because I'm aware that there have been some cases in the UK, I think Hull and Preston spring to mind, where there have been cases linked to schools. And I believe that New York in the USA has also had a similar experience as well. So, and the reason I'm asking is clearly from our point of view, I'm trying to keep a whole family safe. And I'm concerned that at the moment, our biggest single risk is sending our 15-year-old into school, where there have been a number of confirmed cases. And those cases have been self-identified as well. So I'm slightly worried that they are in fact the tip of an iceberg. So I'd be interested in, the opinion of the council on that. Thank you.
Muted. Right. Thank you, Brendan. I will ask Greg Fell to respond, and then, as I've said, we will send you some further information so that you can seek out the guidance and why it is in place and all the evidence on it following the meeting. Greg?
Thanks, Julie. So a reasonably long and complex answer, and I will do this in writing as well. Thank you, Brendan. So it's fair to say the science isn't definitive. There are some uncertainties in the science. The general look and feel of the science is that children are at lower risk of having severe infection. I think that's fairly well established. In fact, no, it's conclusively established. And children are less likely to transmit the infection than adults for reasons that actually I'm not sure we fully understand. Thus, families with children in school may not have higher risk than other families. And there's some fairly comprehensive stuff from SAGE on this one, and rather than trawling through that great length now, it's a very, very, very long and detailed. We'll ensure that you get a proper answer. I mean, in turn, SAGE, I think, have considered about 5,000 articles on transmission risk amongst children. My sort of general sense on school transmission of virus and the risk-benefit balance is thus. School is good for kids. Not being in schools is not so good. I think that's fairly well established. And that's from a kind of a missing education opportunities. There's that again, pretty well established. Most of the transmission is occurring in household settings for reasons I set out earlier. Less risk mitigated, more sense of security. We all think we're going to get this outside the household from strangers. The reality is the converse. All of our intelligence is telling us that school-based cases are reflective of community transmission. So a school with a large catchment is going to get cases because they've got a large catchment. There will be some school-based in-school transmission, but it's relatively small and actually quite difficult to pin down. It's difficult to pin decisively down. The available evidence says that living with someone is riskier than the school environment significantly. There was the Open Safely study set that one out, and the Science Media Centre comment on the Open Safely study was really, really worth the read. And I shall again make sure you've got those. Make sure you've got those links. No doubt that opening schools and universities, as very obvious with the data, has put significant upward pressure on infections. More humans mix and interact with each other. And then that's the cost of the cost of opening schools, which is good to provide education for children, has been upward pressure on infection. But as I say, most of that is household acquisition and household to household transmission that happen to be associated with a school. Schools have worked hugely hard on risk mitigation. COVID secure doesn't mean zero risk, it means risk mitigated. It's important that we're all clear on that one. But schools have worked hugely hard on risk mitigation and have pretty good protocols for managing cases as and when they occur. To my knowledge to date, I don't think we've closed any schools. I don't think we've closed any whole year groups, but we have sent plenty of bubbles home, and we're working entirely within the Public Health England guidance. But the transmission that is occurring would appear to be, again, it's quite difficult to nail this completely, but would appear to be staff passing it to each other rather than children passing it to each other. And so the concern is staff room rather than classroom. And again, that's about a guard being down. And I know the same is happening in NHS premises, for instance, clinic versus staff room. So, but as a rule, schools are as safe as they possibly can be, but there is a residual risk, but the risk is pretty small. It's difficult to be precisely quantifiable about it. I hope that helps, and we'll do a full written answer as well.
Thank you.
Right, thank you. The next question is John Hayden. Is John with us?
I think John might have already left, Julie, so I have
Okay.
to do a written answer to.
Okay, as I've said, we do have people that have submitted written questions but aren't with us, so we will get them a written response. Is Linda with us? Linda Kirk?
I'm speaking now. Has that got me through?
Yes, it has. Yes,
Okay,
Linda.
it's a very simple one that we're used to seeing outside hospitals, and some of us live near or go past our trust hospitals quite often. Thermometers about fundraising or signals about now we're proud to be a non-smoking whatnot. Might it help us concentrate on the danger if we saw a daily update? There are so many COVID patients in here now, and we saw that figure go up and down as we went past.
Right, a very interesting question, Linda. I personally would need to give that some thought, but I think it's more appropriate for our communications colleagues in the communications team who have been managing a communications plan throughout with all the different types of information that we give out to help and support people and guide them to making the right decisions. And I'm going to send it to them and ask them to think about this one, consider it, obviously talk to the other partners that are involved in our local resilience forum, for example, and we do have a sort of communication sub-team of this prevention and management board. So I don't think you're going to get an answer to that, yes or no, it's a really great idea. It's a very interesting idea, and I think we need to let the comms colleagues consider it and think about how that might be done if it's done, if that's all right with you, Linda.
I could see it would absorb some time and energy, the same way as, you know, running the flag up the pole to celebrate a birthday does. But it seemed to me it might make people more aware of exactly where they were if they saw something shift up or down day by day and feel responsible for it.
Yeah, exactly. As I said, it is a very interesting suggestion, and thank you very much for it. And I think it needs a bit of thought to anything that we can try to help and support people to make the right decisions, and for many very often difficult decisions, but it's definitely an interesting suggestion and one that's certainly worth considering. So we will do that, Linda. Thank you. Thank you very much. Terry Connolly, is Terry with us?
Yes, hello.
Hello, Terry.
Hi. I'm taken a bit by surprise because I didn't get my question in time. Sorry, hang on a sec.
I've got your question, so...
No, I've just found it. Can you still hear me?
We can, yes, please ask.
My question was that placement in Tier 3 is presumably good news in terms of bringing transmission down and bringing extra testing and resources to the city. And I'm just thinking that the restrictions are manageable for those of us with plenty of resources, but isn't our challenge now how to make this work for those most disadvantaged by the restrictions, those in poorer communities, people living alone, but also retail and hospitality. And I'm just wondering if the board has ideas about how to encourage Sheffielders to work together for the good of all.
Right, Thank you very much, Terry. Yeah, absolutely. We've said it on many occasions how, not surprisingly, because we've always known it about the cohesion that we have and inclusivity that we have in Sheffield, how people have come together actually, all the community organisations, all the private sector, the council and the rest of the public sector have come together to collectively try and deal with the terrible virus itself, but also the impact that lockdowns have on people's lives and livelihoods too. And we're constantly thinking about how we can do that, and we've got many organisations that are working with us and working together in order to do that. I'm not sure a citizens' assembly personally would have the time in order to take that through, because citizens' assembly do need to very seriously consider many factors and receive quite a lot of evidence. But when you suggest some sort of task force to come up with creative ways to help us all manage, then in a sense the council is sort of leading on that, like leading with all the other providers. And certainly this prevention and management board is here for that exact purpose, which is to consider how we can better manage and guide our way through this terrible pandemic that we have and beyond, because as you've heard Greg say earlier, the vaccine is on its way, but it won't be the silver bullet that quite a few people think it might be. So we've got many months ahead of us as well. So we're constantly looking at ideas, which is why I would say to yourself and anyone else like Linda, who's just come up with some sort of idea of how we can continue to keep us all safe and protect the most vulnerable in particular. So we will take that forward and think about how we can, if there's anything that's missing, that we can bring together after at the next board meeting. We can have a discussion about that. So thank you very much. But if you've got any ideas that you've put on your question, sort of like a rain check voucher system. We are doing something regarding shop local at Christmas. And there's lots of different things coming out. In fact, I had a meeting this morning about how we can make Christmas, albeit it's going to be very different and not as we know it, but still try and find ways of making it special, but also helping individuals, households and businesses at the same time. So you've given us some ideas there, and we will be sharing those, putting together some sort of communications plan to engage with the wider public about certainly things that you can do over the Christmas period and how we can help people, whether it's an individual person through loneliness, or it's a family looking for things to do, or whether it's a business trying to attract more customers. So we're constantly doing that. But thank you for the ideas you've sent, and if you've got any more, they are greatly appreciated. Thank you.
Thanks.
Paul May. Paul, I think we've had you before, haven't we, Paul? A regular, I think. Very welcome.
Unmute. Okay, you happy?
Yes,
sound?
please.
Good.
Yes.
Is the chat system working? I put a question up on chat. It didn't seem to do anything.
I have answered a few. Trust me.
Okay.
But what I was going to do on the chat, if someone's raised a question on the chat, you're the final person that's submitted a question. So as soon as we've responded to you, I'm going back to the chat to see if there's anyone else that wants to come in and ask a question. That was the next thing to do, Paul. Okay.
Fine. Thank you. Okay. Well, this is about comms again. It goes back to what question I asked in September. Your comms team has actually answered my 2 questions, which I submitted earlier in the week. There's a couple of little things I'd like to follow up on them, if that's all right. The first one was about I'm just trying to remember what it was now, but listening to what everything everyone's been saying. It was about publishing, that's what it was about, publishing the MPs and members bulletin. And the answer that I got was there's nothing associated with that bulletin and the COVID board that we're looking at now. So they didn't think that was of interest and importance to the general public, whereas I kind of question that a little bit. My question wasn't really specifically about that bulletin and your board, but it was about the bulletin in general. This goes out to members, it goes out to MPs. I just thought at that point that it would be good if, even if it was amended a little bit, information got out to the general public, which they wouldn't necessarily see from that bulletin. That was my first question. The second one was the comms again. I was looking for notes or minutes, or notes really, of these meetings, this meeting that we're talking about now. And I couldn't find any notes from the public question and answer sessions. And the answer I got was because it's not an official council meeting, then notes and minutes aren't taken. But it struck me that a number of questions are asked and a number of people on the board answer questions which the general public would like to see. And also maybe they say something which, if it's not published, can get lost or forgotten. I mean, today, for example, 2 or 3 people on the board have said, we'll follow up on that, we'll get that out to you, we'll do this and we'll do that. But if those things aren't written down and we can see those in notes, do they get lost? You know, that was my second question.
Oh, okay, I'll let Greg answer, but I will try and respond to sort of the comments regarding the bulletin in particular. The bulletin that goes out to MPs and members is very very comprehensive, in a sense that it covers an awful lot of information, and I think it's in a way that's appropriate for councillors to pick out and share with their constituents and MPs likewise. And we didn't feel it's appropriate to circulate that to the wider public. However, what we do is anything that's in that bulletin that we believe would be helpful for the public, it does go out to the public. And anything that comes through this process, like you've just explained, if someone asks a question and we say we respond in writing, and we believe that would be helpful for the wider audience, i.e. members of the public or anyone specific, then we will share that in the ways that we have. And at the end of the session, I'll just read out the ways where you can access information. But if there is any information that anyone brings to our attention, whether it's through this process, directly through to the Prevention and Management Board, posts it on our Twitter account or anything, in any way that we get information that we think, that would be really interesting for more people, we try and find a way of getting it out to them. I think you just have to trust us on that one. And if you have got some information and you think you can't find it anywhere, then if you draw our attention to whatever that information is, we'll find a way of getting it out. And this is why we have these sessions as well. And Greg does tons of information and YouTubes and videos and everything. So we find different ways, whether it's a YouTube video or if it's on the website or the newsroom or Sheffield, welcome to Sheffield site, or there's lots of different ways. Greg?
Yeah.
Thanks, Julie.
Can I say one thing in relation to that? Thank you, Julie, for that answer. In relation to these meetings, you said there's lots of ways that you can find out the information. I've only just found out today that I can actually go back and see recordings of these group meetings, but that wasn't easy to find that information. And then I've got to make an effort to get on the right site and search through and find it, as opposed to straightforward notes. That's my only point. I just thought it was a bit harder for me to find that.
Okay. I'll bear that in mind, Paul, whether it's something for the panelists, the board, could consider whether certainly all those that have submitted questions today or registered as in the audience, whether we've got the questions recorded and we do record the answers, whether we circulate it to all the people that have registered. That might be a good suggestion, a good start, because at least the people that are here are very interested. That's why you're here. So if we at least get the Q&A with the answers and then we circulate it to everyone that's here, we'll do that as a start and think about beyond that, Paul. So everyone will get that's here and Q&As for people, even those that have submitted them in writing and weren't here to ask. So I think that's a good suggestion, Paul, and that's a starter for 10. We'll do that.
Thanks.
Greg.
Thanks, Julie. Nothing much more to say. I mean, the Q&A is all fairly straightforward, non-controversial, non-sensitive. Can make that available. We'll find a place on the website to put it. It's fairly straightforward. As Julie said, I'd spend my life communicating with people about this on every form of media that you could possibly imagine. I struggle to work out what more I could do, but we'll always welcome bright ideas.
Okay. Can I have two extra quick questions?
Oh, go on. I'll let you.
One to Greg. It might not be a quick answer, Greg. Why is the track and trace in Sheffield so much better than the national, the NHS one? You quoted.
It's a really quick answer. 1, local context matters. 2, local knowledge matters. 3, we're finding that a Sheffield number matters. People will be more likely to respond to a Sheffield number than a random number that could be an anonymous number, and that's a finding that's fairly consistent from all the places that have stood up local contact tracing teams. And sort of we're also finding that local voices matter, and it's the little things that all seem to collectively add up to making a bigger difference. And our findings are pretty consistent with everywhere else. Most notably, Calderdale are probably a month ahead of us, and their completion rates are, I think, about 84% now. So we've got something to aim at. But it's pretty simple. It's the local knowledge, local context matters. Who would have thought that would be the case?
Yeah, common sense.
Yes.
Thank you, Paul. Before I go on to the chat, Shafak, you asked to comment on something, and I'm like trying to look at the Q&A, look at the chat, and read the questions. Would you like to comment on anything right now?
Yeah, I mean, there's a couple of things. I think it was in response to both Linda and Terry, but actually what Paul said in the sense of communications is an area that we look at. I mean, today the panel's pretty heavy loaded by councillors and council officers, but I think the kind of logos that Dan put up at the beginning of the meeting shows that actually this group that we meet regularly on a fortnightly basis is a lot broader. And I think particularly the messages that Terry wanted, I think definitely we have the networks there, whether it's the Chamber of Commerce, the faith community, community organisations. So I think the message, Chair, would have been to Terry, look, it's definitely something that we'll take away. Clearly, we need to have a conversation, but we do have a wider network than just the council. And in terms of Paul's thing, he is a constituent. He's Chair Ecclesall. So clearly,
your fault then he doesn't know anything.
So I recognise Paul. Clearly, look, I mean, whatever information we can get out, somewhat we'll take away, Greg, and look at how we can do comms, but clearly there is a workload limit on Greg's shoulders. That's the only thing I will say. There are some other areas of work that I probably want Greg to be on to as well, but comms, whatever information, clearly if we're going to write to Parveen with a very important answer around, that very important birth and what will happen, I'm not sure that's that sensitive and specific to her that we could not share that answer. I'm sure Jamie will want to share that answer wider than just that one question. And so where there is information like that, I'm sure we'll look at how we can share. Clearly there'll be occasions when stuff's asked of us privately that we can't share, and that clearly, Paul, you have to trust us on that one. There's a confidential nature of some of the information that's shared by Greg to myself and others.
Thank you for that, Shafak. I'll bring Jack in a moment, but there is someone exactly I believe in that position where on the Q&A that's raising a very personal, very sensitive and emotional question. And I think that deserves a personal sensitive response from someone. So I was going to suggest that we contact that person directly and engage with them to help them throughout the circumstances they're finding themselves in. So that's a question I wouldn't be asking to be raised today, but certainly to say we will be responding in, as I say, a very sensitive and personal manner. Jackie.
Sorry, mine wasn't in answer to Paul, but thanks for the questions, Paul. And it's to echo something that Councillor Shafat Mohammed said in answer to Terry. You know, there are a lot of our community organisations that are doing a lot of the things that you were saying about, you know, and coming up with good ideas. And I know, for instance, the Healthy Holidays programme and project that's been going on during school holidays is going to go on through the Christmas holidays, and some of our community organisations are making sure that community boxes or activity boxes get out to the, you know, the children in our communities, the most vulnerable children in our communities. So there will be all sorts, and we know that all sorts is going on, but all, as the leader, Councillor Julie Dorr, said, any ideas are great to hear from people, and also great thanks to everybody that's out there doing it. I too, Councillor Dorr was going to mention that, not mention, but I noticed there was a point and a question in the chat, and I think we need to address that, as you said, individually with that person. Thank you.
Yeah, I'm just sending a response to that. Right, thank you. We have Cheryl, who's raised a question on chat. I think we've got about 10 minutes left, so we'll go through these. Cheryl Lodge, is Cheryl with us?
I think Cheryl's had to leave, I'm afraid, Julie.
Yeah, Cheryl's question in a sense relates similar to another one regarding the schools, doesn't it? That made a suggestion around closing schools a week early, but I think Greg sort of more or less responded to that. And also to say, yeah, I'll bring you in, but also to say we need to make it clear what government decisions are and government instructions are. And it's not just government guidance, it's government instructions, and just differentiate between where it's the government that's making these decisions, they are instructing us to carry them out, and where we have some flexibility or discretion. Greg.
Sure, very briefly, thank you. It's not our call, in short, it's a government call. The government are responsible for decisions on closing schools, and they've made that very, very, very clear. The Prime Minister was absolutely crystal clear in his statement on the winter plan last week. The government may choose to close schools a week early. I do not think they will. I genuinely don't think they will. It is their call. There is an unanswered question that comes to us from schools who are doing contact tracing for cases and contacts in schools, and schools are doing an amazing job at that. Do we want them to do that over the Christmas period? And schools are quite rightly saying that the heads are saying our teachers need a break, and they do need a break. So again, we've asked for advice from the Department of Education on that one. But my anticipated default position is that schools will not close early, and we will not. The government will not be asking schools to do contact tracing over the Christmas period. And if that changes, then clearly we'll adapt our plans. But that's my working assumption. But that is an assumption.
Right, thank you very much. That concludes the questions. I want to thank Jamie in particular for coming along and sharing all that helpful information. And certainly, of course, to Greg and rest of the panelists and Dan. So just before we go, just to say that we have several sites of information where you can go and seek further guidance. Of course, there's the sheffield.gov.uk site, and you can navigate yourself around that. I acknowledge for some people it can be quite difficult. We have the chefnews.com where you can get further advice. We have a Facebook and a Twitter account, Sheffield City Council. And you can also register for email alerts where if you've registered, if there's any news coming out, automatically goes into your email box, which I find very useful, and I get them several times a day. Douglas has very helpfully put up the minutes of the COVID Prevention and Management Board that Shafak talked about, or on the website, which is sheffield.gov.uk. But then, of course, if you want to get it directly to it, it's there, /home/your city council preventing and managing COVID-19. So there's that way you can find the minutes. There's also a helpline, which is a Sheffield number, 273 4567. And that's for anyone, any member of the public household, and in fact businesses or anyone, that helpline. But if you're a specific business and you want business guidance and help, it's 224 500. So that's 224 500, which is Business Sheffield, and the Sheffield Council helpline is 273 4567. And of course, there's many voluntary organisations out there that offer advice constantly, and I've done throughout. So thank you, Philip, for saying thank you. Not much wrong with outcomes, great. So on that note, I will say thank you to everyone for coming. Thank you to our panelists. And the next session is 18th of December, I understand. So look forward to seeing you all again on that day. Thank you very much. Take care. Have a nice weekend.
Thank
you. Thank
Bye.
you. Bye. Bye, everybody.
Bye now.
Yes, bye.
Bye.